You are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. A 57-year-old postmenopausal woman with a history of multiple sexual partners presents to her gynecologist with complaints of bleeding and discharge per vaginum as well as severe pelvic pain. She also indicated to her gynecologist after being asked that whether or not she had done the pap smear test. This patient indicated that she had never done a pap smear test throughout her lifetime. Now, a biopsy from the cervix was taken to the pathology laboratory, and findings indicated that this patient had cervical cancer. It was also indicated that she had the commonest cervical cancer type, and that the pathologist speculated that the cancer possibly emanated from the transformation zone of the cervix. So this is the case study we have before us, and then we have these questions here to go through. The first question is this. Now, what is the cervix? Now, my friends, anytime you hear of cervix, literally it means neck. Now, it therefore tells me that you need to know which subject matter we are talking about for you to clearly know which cervix we are talking about. Because the point is that we can be talking about, for instance, the cervix, the real cervix as far as the main body is concerned. So, for instance, you have some vertebrae, bones over there. We call them cervical vertebrae. Why? Because these vertebrae are related to the neck. Yes, if you look at your teeth, okay, if you take one tooth, you will see the crown, you will see the root. In between them, there's also the cervix, which is, of course, the neck of the tooth. Okay, so these are things which I want you to understand. That whenever we talk about cervix, you need to know, okay, the area of interest that we are talking about. But this time around, if you look at the question, the nature of question, you look at the nature of the presentation of the case study, you appreciate that once this individual is bleeding per vaginum, then it therefore tells you that we are looking at the cervix of the female reproductive system. And my friends, whenever we talk about the cervix of the female reproductive system, we are talking about the neck of the uterus. Yeah, that's one thing I need you to understand. So whenever we hear of cervix, okay, we are talking, as far as the female reproductive system is concerned, we are talking about the neck of the uterus, which projects into, of course, the vagina. So one thing that we need to understand is that you look at the uterus, we have the body of the uterus, okay, and we have the neck of the uterus, which I'm saying that it projects into, of course, the vagina. Now, whenever I mention the cervix to you, one thing I need you to also understand over here is that we have two main parts. At least for now, you should know about that one. Two main parts. We have that portion, which is in line with, of course, the uterus, the body of the uterus, and that becomes your endocervix. Because if we are moving from outside to inside, then of course that becomes the one where it's more inside, okay, more internal, and that's why we say that one becomes your endocervix. Or because it's found above the vagina, we also call it the supravaginal part of the cervix. Okay, and one thing we appreciate is that the epithelial lining over there is going to be simple columnar epithelium, consistent with that we see in the body of the uterus. Okay, but what we see is that the infravaginal part, or the vaginal part, or the intravaginal part, the one where is actually projecting inside, where is actually inside the vagina, okay, that portion is going to have an epithelial lining which is consistent with that of the vagina, and that is why its epithelial lining is going to be stratified squamous, non-keratinized epithelium. That is one thing that you need to become aware of. Now, so that is one thing I need you to know as far as knowing, some basic things about the service is concerned. Now, the next question for us, question number 2, is that yes, it was indicated that the cancer began or the malignancy commenced in what we call the transformation zone of the cervix. And so, my friends, what is this transformation zone? My friends, one thing that I need you to understand is that the transformation zone is that portion. It's more or less like a junction, which of course we see the simple columnar epithelium, the columnar epithelium coming from the endocervix, okay, meets with the squamous, the stratified squamous non-keratinized epithelium of what we call the ectocervix. And my friends, one thing that we are aware over there is that at the level of the transformation zone, that is where we see a lot of the malignancies as far as the cervix is concerned commencing. And so most of the cervical intraepithelial neoplasias will commence at the level of the transformation zone. Okay, and that is why there was that kind of speculation among the pathologists that possibly the cancer started at the level of the transformation zone. Okay, because at that point we see a lot of the insults to the cervix. Yes, that is where it receives most of the insults, because at the end of the day, that's the junction. And one thing too that I want you to understand is that whenever the cancer is going to spread, the stroma that is deep to, of course, the epithelial lining, which will be the one which of course will contain, we contain a lot of blood vessels, to contain a lot of lymphatic vessels and all that. It will also secrete some kind of tumor promoting factors, so to speak, some good factors to help the cancerous cells, okay, to grow uncontrollably and divide uncontrollably. Okay, that is one thing I need to understand. Okay, so the transformation zone, what I'm trying to say is that area where most malignancies will take place, and it is of course that squamo-columnar junction of the cervix. Now the next question is that it was indicated that this patient possibly, yes, based on the findings, from pathologists, was having the commonest cervical cancer type. And so, my friends, what's the commonest cervical cancer cell type? Your answer is squamous cell carcinoma. Squamous cell carcinoma. Already I've told you. So that the transformation zone, where it's more towards what we call the ectocervix, and we see more of what we call, the squamous epithelial lining. Okay, well, of course, there could also be something we call columnar metaplasia and all that. Squamous metaplasia actually. What will happen is that the columnar epithelium may be converted to become what we call squamous epithelium because of the stress that we've put over there. Now, the next question is that, what are the things, by way of the signs and symptoms that this patient presented with that clearly indicate that this patient is having cervical cancer? And my friend, the answer is so clear. Bleeding per vaginum. Now, yes, some people will say vaginal bleeding, but we want to specifically tell you where the bleeding is coming from. So it comes from the cervix, but it is bleeding via the vagina. So we say bleeding per vaginum. And of course, there will be some, a lot of mucous secretions also coming out, and also pelvic pain. These are classic things that, yes, every patient, once cervical cancer is there, especially the bleeding per vaginum. And you know that even for this patient, she's in her postmenopausal stage. We don't expect her to be bleeding at that point. Okay, so these are the important things which I would need you to understand. Now, the next question is that what is the most significant risk factor for this patient, okay, to getting the cervical cancer? And my friends, the answer is so clear. In the case study, was indicated that this patient has or had sexual multiple partners. So whenever you are having sexual multiple partners, okay, heterosexual, okay, the opposite sex, what will happen is that as a female, okay, the male will be giving you, of course, the semen, and it may contain some of these, viruses, okay, by way of the human papillomavirus. Different strains may be carried by different men, okay. So if you are not fortunate and then you receive the most virulent forms of the strains, okay, like strain 16, 18, then it's likely that there could be that kind of, malignant, changes, okay, neoplasia happening at the level of the transformation zone, okay. And that is why it is important that whenever any female, yes, begin seeing a man or whatever, what will happen is that the person, yes, perhaps annually, yes, decides, to go through what we call the pap smear screening, so that quickly those kind of cervical intraepithelial neoplasias, those pre-cancerous changes could be detected earlier, so that treatment, yes, could commence, timeously. So that is the important thing which I need you to, of course, become aware of. My friends, I believe you find this meeting helpful. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.